My name is Samir Somaiya. I'm the chairman of the J Somaiya Medical Trust, here located in Mumbai. This institution was founded in 1991 by my grandfather, Padma Bhushan Karamshi Jethabhai Somaiya. He was born in 1902, born poor, and he witnessed the lack of education and healthcare at close quarters through the passing away of his mother when he was 3, his first wife within the first year of marriage, and his daughter who was also very ill when she was young. With that having influenced him, he really wanted to create a way to give back to society because he was very successful in business. The way he decided to give back to society was through creating opportunities for education and for helping healthcare. In 1959, he created an institution called Somaiya Vidya Vihar here in Mumbai and doing a lot of work in education also in rural Karnataka and rural Maharashtra. 1991, he created the J Somaiya Medical Trust to bring a further facet to this, and he called this place Somaiya Ayur Vihar. Somaiya Vidya Vihar was a place for education. Somaiya Ayur Vihar was a place for health. But with health, it was also the health education as well as the treatment of health. So we've completed about 25 years in our in the health sector. Started as a teaching hospital, and as a teaching hospital, it has centers for J Somaiya Medical College, it has a physiotherapy college, and it has a college and school of nursing. The dream was that we create a place where all people can find cures for their ailments, or at least answers to their ailments. And they should be from all demographics, people who can afford and also people who cannot afford. The first 25 years were largely spent in dealing with the service to those who cannot afford. And that has been a wonderful journey. Even if I look at it, the daily OPD outpatients that we get to our hospital are about 1,000 outpatients a day. It's a 500 to 550 bed teaching hospital, doing great service to the society. Last year we decided that we wanted to also bring in a model where we bring a super speciality, and so we've created a section of cardiac care and other super speciality orthopedics here, which we have just started. And we've also created what I think is a world-class emergency care. The reason why we did that emergency also is because I had a personal experience. My father had an accident in Australia, which he passed away there. But I saw a fantastic emergency over there and how they took care of him. And although he passed away, I think they did their best. And I thought that we should also create a center over here which can match. I think the healthcare scenario in India is of two extremes. On the one hand, I think that from a point of view of expertise, capability, competence, we are probably, as in terms of delivery of care, outstanding and amongst the best in the world. On the other hand, if you look at our population and the accessibility and affordability of care, you find a gap over there, because the number of doctors per 1,000 population across the fields, and then the distribution of that between urban and rural India is also an issue. So we really need to create much more capacity. So superb competence in the treatment of medical conditions, but we need much more quality and penetration elsewhere. On the research side, I think India needs to do a lot more in terms of creating healthcare research, whether it's in devices, whether it's in treatments, or whether it is in even medicines. So I think this is what my view on. One way is we are part of this larger organization, Somaiya Vidya Vihar, Somaiya Ayur Vihar. So there's a lot of exchange that happens of knowledge that we want. We want to create this much more like a seamless system where knowledge goes back and forth. To give you an example, recently we've created a 3-acre Ayurvedic garden, 100 varieties of plants and 6,000 of them. So now we are talking to our botany department to try and understand how what plants are grown. You talk to a pharmacology department to understand, or a bio department to try and see how they can extract what are active principles there. Can you then start doing joint research between what you're getting in these and putting it in and just seeing how the care works. Now you can merge that in the future, whether you start bringing cell lines in it and whether you want to see synthesis of molecules in it to see where, if you're doing cancer care, for example, whether the cell lines are working So I think there's a lot of work and imagination has to come to the fore. Just to add to that, I have a professor of, he's a joint director of metastasis at the MD Anderson School Cancer Hospital in Texas, which is among the best cancer care places in the world. He's volunteered to come for 2 weeks to our college to teach cancer biology. So I think, that, and yesterday I had Professor Larry Walker, who was Cornell Chemical Engineering professor. He says he's very happy to come and be a visiting faculty at our institution here. So I think the moment you have people like that who come here, they will definitely raise the standards and they will work with the faculty we have, because I think in research we can go forward. So here we really dream of creating this as a referral place for, I would say, Asia, and that's a dream. We've already planned for a brand new outpatient center over here, which is large. We've planned for we planned for an oncology center working with the Asian Cancer Institute. We're trying to create, we want to go to world-class care and world-class education and world-class research. At the same time, remembering very, very much our founder, my grandfather's vision of creating a place that would be of service to all who come here for care. I mean, one test, like a litmus paper test I have is, suppose he would have come here with his mother or his wife who was ill. Would she be welcome when he brings her here in the campus, when he came with that demographic profile that he had? And I think that's always the litmus paper I have, that would the founder have been proud of what we have created from a service mission. In education also we have to try to have the same litmus test. So clearly we have to create a model that works, but we want to build a model that is far more that is, so we definitely want to work. So I mean, just to switch a bit in the school as well, we want to make sure that if he came as a parent, would he be finding welcome over there. But one reason why we've created the super speciality wing over here is so that we create a critical mass of the care we provide, and as we provide a critical mass, then the cost of medical education also comes down. So currently the hospital has got two wings. It has the teaching hospital wing, it has a super speciality wing. And so at the teaching hospital, there is no charge for medical consultation, and they stay in wards, and the charges in a ward are, I think, in the tune of 100 rupees, 80 rupees or 100 rupees per day, which includes food. So it's a very, very reasonable system. And even in the super speciality wing, we aim to be at a cost. So we do the Rajiv Gandhi Yojana programs, we're trying to do CGHS, and we're trying to be at a price point that is lower than our peers. And we want to be the best care provider. No, I think we have to build that. I mean, we are a trust, so for example, we don't have a cost of land that we have to recover. Today, if you had to do something like this in Mumbai city, you would have, if you had to try it, you have to buy land. So here there is no land. Secondly, I think we're trying to see how we can create assets over here, which are also partly donor financed. So moment you have donor financed assets, then it's a cost of recovering your running costs rather than also cost of capital.